My name is Dr. Katinka van der Ven. I worked on a project team which developed a GP guide to harm minimization for patients using non-prescribed anabolic androgenic steroids and other performance and image enhancing drugs. So the guide is available on the Sydney North Health Network website, and it covers aspects such as red flags, background, assessment, management tips, referral sources, information for health professionals and patients, and gives access to this webinar and others. So along with the guide, we developed a series of short-scaled based webinars. So this includes the one that I'm presenting now on the introduction to PIEDs, prevalence, what, why, and how. So it discusses types of performance and image enhancing drugs. It will discuss prevalence, why people use these substances, and methods of administering. The second will focus on how to identify non-prescribed anabolic androgenic steroids, which covers aspects like red flags, screening, and assessments. We also have one that is focused on how to manage non-prescribed steroid use, which talks about adverse effects and managing withdrawal. And finally, we have one on how to manage a patient who does not want to stop using non-prescribed anabolic androgenic steroids. And this discusses how to engage pre-contemplative patients and harm minimization. So I'm a senior lecturer at the Center for Rural Criminology at the University of New England, and I'm also a visiting fellow at the Drugs Policy Modeling Program at the University of New South Wales. So I conduct research around the use and supply of PIEDs, which includes projects surrounding anabolic androgenic steroids and drugs policy, harm minimization, evaluating doping prevention programs, and improving health services for people who use these substances. I'm also the founder and director of the Human Enhancement Drugs Network. So the aim of this network is to improve the evidence base around enhancement drugs, develop educational resources, and to connect people working in this field. So we currently have over 90 members from 15 different countries, which includes academics, lawyers, health professionals, anti-doping professionals, and people who use these substances. I'm also the editor-in-chief of Performance Enhancement and Health. I've co-edited the Routledge book on human enhancement drugs, and I've published numerous peer-reviewed papers within the enhancement drugs field. So the main learning aim of this webinar is to have a general understanding of the non-prescribed use of steroids and other PIEDs. So after this webinar, you should be able to identify commonly used PIEDs and the use in the community, understand prevalence of PIEDs, reasons for use, and commonly used substances, understand modes of action, and also how they're administered. So let's start off with what PIEDs actually are. So performance and image enhancing drugs are drugs used to enhance the appearance of a person and or to improve their physical capabilities such as strength or endurance. The term represents a wide range of substances, but the oldest and largest group used are non-prescribed anabolic androgenic steroids, which have been used since at least the late 1940s. So the term PIEDs is generally used as people who use non-prescribed steroids commonly use other enhancement substances as well, as you, for example, can see in the information pamphlet on the right. So what types of PIED are typically used? So the main substance used, at least by men, is, as I already said, anabolic androgenic steroids, which is usually typically used in combination with other PIEDs. So people who use non-prescribed steroids often use other PIEDs and illicit substances to achieve augmented effects, to minimize adverse effects of steroid use, and also for just recreational purposes. So the table on the right just shows some examples of other substances used. So for example, tamoxifen is used to prevent gynecomastia, human growth hormones are used for anabolic effects and strength, to burn fat and for weight loss, and ephedrine is used to increase energy and boost training, and also is used to enhance weight loss. So for more information on this, I would like to refer to the guides which we developed, which gives a more comprehensive overview of the different types of PIEDs being used and why they're being used. Also, I'd like to note that the use of non-prescribed steroids may lead to a range of adverse effects. If you'd like to know more about this, I recommend watching Dr. Eva Jackson's webinar, who discusses this in more detail. So just to give some examples of steroids. So in this slide, you can see 3 different types. On the top, you can see Winstrol, which is a water-based injectable steroid. On the bottom left, you can see Sustanon, which is an oil-based steroid, which is a mix of 4 different types of testosterone. And on the bottom right, you can see Dianabol, which is an oral steroid. So oral tablets seem to be more popular amongst younger people who use these substances. But a particular issue with this is that they are more toxic to the liver. So let's have a look at the prevalence rate in Australia. So when looking at the population studies, we see that the use of PIEDs for non-medical reasons is relatively low. So the National Drug Strategy Household Survey shows that less than 1 in 100 aged 14 and above reported steroid use for non-medical purposes in 2016. So when looking internationally, we see similar figures ranging usually between 0.5 and 3%. However, these numbers are much higher when looking at studies that specifically target high-risk environments, such as bodybuilding gyms. So, for example, one Australian study showed that 50% of male gym users use non-prescribed steroids and other PIEDs. This is, of course, very targeted and does not give a good overview of the use in the general population. So the true prevalence rate in Australia is unknown. But there are other indicators that PIED use is rapidly growing, particularly in the time period 2005-2015. So for example, the Australian Needle Syringe Program Survey National Data Report showed a significant increase in PIEDs as last drug injected over the period 2010-2014, being 7%, followed by a small decline in 2019. Interesting, though, is that New South Wales is one of the states where last drug injected is higher than the national average, with numbers remaining stable at between 10 and 12%. So at what age do people start using steroids? So between the ages of 20 and 24 years old, and use can start as early as 14 years of age, but this is rare. We also see a group of older men of 40 and above who start using non-prescribed steroids mainly for anti-aging purposes. But motivations for using non-prescribed steroids and PIEDs vary, although the most common reported reason is for aesthetic purposes, so changing their body image, or for cosmetic purposes. So other reported motivations are for recreational and competitive bodybuilding, to enhance sport performance, to enhance occupational performance. So think, for example, of a security staff member who uses steroids to become stronger, hormone replacement therapy, retaining youthfulness, for anti-aging purposes, to aid injury, pain, and anxiety, or to increase confidence. When engaging with patients who use non-prescribed steroids, it might be good to be aware of some common terminology used by people who use these substances. So a common term you might hear is the term cycles. So steroids are mostly used in cycles with a duration between 6 and 18 weeks, termed on cycle, which is then followed by a similar period of steroid-free training termed the off cycle. So the rationale behind the strategy is to gain muscle mass and strength during an on cycle, allowing the body to recover during the off cycle. There is, however, limited evidence to support the effectiveness of this approach. However, what we see is that people are increasingly using steroids who either take no break or a very short break. An example of this is called the blast and cruise approach. So blast and cruise is the continuous use of steroids involving a high dose called the blast for a set period, followed by a lower dose called the cruise, again for a set period. So this rotation can continue for an extended period, sometimes up to several years. And due to the lack of an off cycle, this approach may potentially increase health risk associated with testicular shutdown. Finally, something you might also commonly hear is the use of post-cycle therapy. So primary concern of steroid use by people who use this is that it potentially can suppress natural testosterone production. So in response, some consumers will use other pharmaceutical substances during or after cessation of the use of steroids to help restart natural testosterone production. However, again, there's limited evidence to support the effectiveness of current PCT approaches. So finally, how do people administer non-prescribed steroids? So steroids are mainly injected or taken orally, depending on the product. And it's common to see people using a mixture of both injectable and oral products. So for example, in a global study involving more than 1,000 men who use steroids, around 30% reported using both injectable and oral steroids in their lifetime. Both routes of administration carry, however, risk, either via the injection process. So for example, one Australian study showed that 56% of people who injected steroids reported experiencing at least one injecting-related problem in their lifetime, such as abscesses, scarring and hard lumps, and swelling of arms and legs. But as said before, there's also risk of liver dysfunction caused by using oral products. When injected, steroids are generally administered intramuscularly, typically into the glute, outer thigh, or shoulder. And I would recommend having a look at the PIED guides, as there are several resources for health professionals and patients who discuss the safest techniques for reducing steroid injecting related harms, including also a very helpful video. So to summarize, although population studies show that PIED use in Australia is relatively low, there are other indicators which indicate that their use is growing. The most common type of PIEDs are anabolic androgenic steroids. Other PIEDs are often used to achieve augmented effects, to minimize adverse effects of steroid use, and for recreational purposes. Steroids are mainly injected or taken orally, and steroids are used by both younger and older people. And finally, motivation for use may vary, but the main driver is for aesthetic purposes. So more information on related topics can be found in Health Pathways, as you can also see on this slide. Finally, I would like to thank my colleagues on the team that made the guide and the webinars possible, including Dr. Beng Yu, Dr. Eva Jackson, Dr. Esther Han, Dr. Nicole Gouda, Greg Parson, and also Pat Simmons.